Hi everyone, it's Dr. Jacobs, and we're in Module 5. We're talking about therapeutic models for serious mental illness. So I'm going to start off by talking about cognitive behavioral therapy for psychosis. This model is a structured intervention to address the symptoms of serious mental illness, including anxiety, delusions, depression, hallucinations, mania, hypomania, anhedonia, negative symptomology, sleep difficulties, and hopelessness. It can also target areas like interpersonal problems, isolation, motivation, social skills, self-esteem, and medication adherence. It is, if you are familiar with it, very, very similar to CBT. CBTP involves establishing a collaborative therapeutic relationship, developing a shared understanding of the problem, setting goals, and teaching the person techniques or strategies to reduce or manage their symptoms. Therapy is usually conducted in individual sessions and is time limited, so it's typically over a couple of months. Patients learn specific cognitive and behavioral coping strategies in order to reduce distress and improve functioning. The goal is to reduce the distress the patient experiences in their daily life. Specific CBTP approaches include cognitive restructuring, behavioral experiments or reality testing, self-monitoring, and coping skills training. Unique considerations in treating psychosis include an emphasis on being non-confrontational and normalizing psychotic experiences. CBTP can focus specifically on psychotic symptoms like hallucinations or delusional beliefs, but it has been shown to be helpful for addressing depression or anxiety that's associated with psychotic symptoms and their impact on a person's life. So the next model that we're going to talk about is illness management and recovery. This model is evidence-based, and it focuses on teaching illness self-management to people with serious mental illness. The emphasis is on recovery by helping clients set and pursue personally meaningful goals. IMR includes 10 modules that deliver psychoeducation about mental illness and cognitive behavioral approaches to medication management, planning for relapse prevention, social skills training to strengthen social support, and coping skills to manage symptoms of mental illness. IMR can be provided in individual or group format, and in general takes about 5 to 10 months to complete because individuals are working progressively through those modules. IMR has been found to significantly improve client functioning in various psychosocial domains, including the ability to cope with symptoms, basic functioning, and overall well-being. Also, individuals who have completed IMR show greater improvements in knowledge and progress towards goals compared with those who received care as usual without this therapy. So the next model we're going to talk about is group interpersonal therapy. So the World Health Organization recommends this model as a possible first-line treatment for severe depression. The World Health Organization says that this model is great. It uses 8 sessions. It describes it as a simplified format. You have to be trained in it. Facilitators have to be trained in it, and it is evidence-based, and you go through the 8 modules with a closed group format. Next, we're going to talk about cognitive symptom management and rehabilitative therapy, also called CogSmart. So there have been a lot of approaches that have been developed by researchers that aim at compensating for cognitive deficits that can be a part of serious mental illness, with the intention to improve functioning and activities of daily living. So CogSmart is a model for that. This approach in particular has been used to overcome a person's perceived lack of confidence in a specific skill area. So this is a model that's often free of charge for people with serious mental illness. It includes 12 learning modules. It can be done independently or with a trainer or therapist. CogSmart was designed to provide individuals with skills, strategies, and tools to overcome problems with concentration or attention, memory, organization, and problem solving. So a typical lesson in this model includes the use of a calendar or a daily planner for scheduling appointments and other important activities, learning to place items like your keys in a designated area, and using Post-it notes to designate where is what thing in someone's kitchen or another place in the home. So the concept with CogSmart is that when you give an approach a try, then you turn the strategy into a habit, and then you use it routinely in everyday life. And then the more you practice it, the more automatic a skill will become. So that is CogSmart. So these programs provide feedback on progress and allow the person to track his or her best strategy to also help with brain exercises. So there's that piece as well. So these are the models that have been proven to be evidence-based and effective for individuals with serious mental illness. Thank you all very much.